Okay, we're back, and I have now on the line with me, I'm your host, BKP. Good morning from the office. I have on the line with me Miss Brittany Ivey. You can see the picture there of her meeting with President Donald Trump yesterday. Miss Ivey, are you with us?
I'm here.
Well, first of all, I'm excited to have you. I'm a little jealous. I have to tell the truth. I'm just going to be straight. I'm a little jealous because I would really enjoy getting an opportunity to meet with the president. But you were sitting right next to President Donald Trump yesterday. Tell our viewers a little bit what that was like being in that room.
I got to sit right beside Thatcher, and I was just as excited as you can imagine you would have been in that room. It was a really humbling experience, and I was really nervous at first, but when he came in there, he talked to all of us just like, you know, he was no better than us, he was no different than us. And
Whoa, stop. I don't mean to interrupt you because this is stuff the American people do not hear. So you're saying when he walked in, this is a billionaire. I don't mean to be rude, but this is a billionaire, and I watch every day the media frame our president every day. So this billionaire came in and sat down, and he let you know he was no better than you, he was no different than you. Is that what I heard you say?
That is exactly what you heard me say, and I'm right there with you. Every day I hear what the media says about him, but what they're portraying him as is not at all the picture that I saw yesterday.
Oh, I didn't mean to be rude, but I had to hear that. I had to hear that again because somehow this president of the United States is staying connected to people much like you and I out here in what I call rural America. Okay, so you go up there. This was a healthcare listening session. The president wanted to listen. And he has had listening sessions, Brittany. He's had listening sessions with CEOs, manufacturers, inner city, different things. This was a healthcare listening session. Did you feel the president of the United States listened to you and any other participants in the room?
I absolutely did. And even after the media left, you know, when he was talking to us kind of individually and repeating back the things that each of us had said in our story. So it wasn't like, I didn't feel like, well, we were just there as media props. He really was still talking to us and addressing us long after the media left the room.
Okay, I'm just recapping because this is stuff the media doesn't say. So when the media is in the room and they're getting their pictures and the photo ops and all those things, when they leave the room, this guy doesn't change. Is that what I'm?
If anything, he becomes more charismatic. He becomes more like the people he's in the room with, was the feeling that I left with.
Okay, let's go to, there was a lady, when we're watching at home, there was a lady to the left of him that was talking about farming and ranching, I think it is, but anyhow. And then I listened to your story. Who else was in that room around the table? How many people was invited to this?
There were, I believe there were 10 of us total, but you had 2 doctors. You had an internal medicine doctor, and you had a trauma surgeon from Vanderbilt over in Tennessee. They were there, and they each gave unique perspectives on what healthcare was doing. From their end, you had another, you mentioned the northern Colorado cattle ranger, but you also had a row crop farmer from Tennessee that talked about the impact that it had on his family. There was another stay-at-home mom like myself that was staying at home and working part-time when the Affordable Care Act was enacted, and it pushed her back into the workforce. She was a nurse from Wisconsin. You had a manufacturer owner. I think he employed roughly 20 people, he said, and at one time he was able to provide health insurance completely for all his employees, but that's no longer an option for his company as the costs have just increasingly grown where he was. You had a business, an entrepreneur from Arizona. Her and her husband both own their own small businesses, and in Arizona, the affordable health care has pushed premiums up by 116% on average. So there was just a unique group of people. We all had different stories, but they all basically were the same. We all made different amounts of money, but we were all paying a large percentage of our income just to have health care.
Well, let me say this. So what I'm gathering for you, and I want to thank you so much for being with us, because we get media accounts of what's going on in these rooms. but you're giving me the best account that I have heard from anybody, and I can't tell you how much I appreciate it. So this room was balanced. It was balanced with doctors. It was balanced with people from across the United States, just not a certain area. It was balanced with business owners that did provide their employees health care that cannot afford it now, farmers, individuals like you and your husband, where I think, just, I don't want to get it wrong, he comes home one day and he says the healthcare costs have gone so high, my employer says they cannot care for the family, so you go out to work to try to go outside the home to work to try to supplement insurance. All of those stories the president sat and listened to yesterday.
That's right. He did. And I could tell too, you know, even when we were talking afterwards, he didn't just listen yesterday. He had been told our stories before, and he cared enough to remember things that we didn't even get to say in our little blurbs there for the media.
So he was briefed, and I know this might sound silly, but I'm amazed with the way this president conducts himself. There's Democrats that say, and I'm not going to go down that road, but there's Democrats. I just got a message from a viewer that said that they have a congressman Democrat in their district that says they have met more with Donald Trump in 2 months than they met with the former president in 8 years. So that being said, but he was briefed on everybody in the room before he came in, obviously the background of your stories. And when he came in, you could tell that he reviewed everybody's story and was aware of what was going on when he came in the room.
Exactly. Yes, sir.
The reason I'm highlighting that, Brittany, is because the media paints this president as somebody that doesn't pay attention or doesn't study or doesn't keep up with things. So I'm just highlighting that because of you're telling, I think you're telling the correct story, but you're telling a whole different story than we hear when we turn on our TVs about this president of the United States. So I hope you understand where I'm going with that.
Oh, I do, because I feel the same way. I mean, I was not expecting the man that I met with yesterday just based on the things I'd seen myself in the media.
Whoa, she was not, viewers, she was not expecting the man she met yesterday based on the things she had been led to, tried to lead her to believe from the media. Brittany, could you share, your story on healthcare with our viewers? Because I listened to your video, and we did do the video at the top of the hour, but maybe for some people that just tuned in, could you share what you told the president? We got a picture of you sitting there, and I seen him look over and ask you for your story. Can you share what you told President Donald Trump yesterday?
Yes, I'd be happy to do that. And I also want to say, Thatcher, before I don't get to now, I also have a congressman, Representative Collins, represents my district. And the whole reason that my story is out there is because I made a comment to one of his aides about how detrimental the Affordable Health Care Act had been to my family. And he cared enough to listen to that story and to follow up with me and to see exactly what had happened. So I want to give him credit for that because he is the reason this story is out there. But basically what had happened to my family was in 2009, I had left work at the University of Georgia to stay home with my 2 children who were both under the age of 2. And the only stipulation my husband put on that was that I paid for our health insurance. We might have qualified for government health insurance, but we never wanted our neighbors to work harder so that we could work less. So I always worked part-time and just paid for our insurance, which was provided through his company, but, you know, I had to pay our portion of it.
I understand.
And then as the premiums rose, they rose 102% from 2009 to 2014. We were paying right at $1,400 for our family plan. When the company came back and said from 2014 to 15, they're going to see another 34% increase. That was going to take it to $1,900 a month. And the company said, we just can't keep your family on anymore. So I knew I had to come back to work, but I couldn't find a full-time job with benefits. So we entered into the exchange. We believed the sales pitch that said, oh, if you like your doctors, you can keep your doctors. So we got a plan through the Obama Care exchange that cost us roughly $1,300 a month. We had it for 5 months, so we paid $8,800 in 5 months for insurance that, after come to find out, our doctors wouldn't accept. So we never used the insurance that we paid so much for. So that's our experience in a nutshell.
Well, that's what I heard you say this morning. And I want to also say I've encouraged all of our listeners. I mean, they are elected officials. They do represent the district. And actually, the day after, the same night they introduced the new plan, the next morning, Congressman Collins was on our show and was explaining it to the 9th District and all of our viewers what was in the plan. So I want to say also, and I agree with you, call your congressman. I say that, call your congressman, tell your story, okay? Because they are getting inundated, the congressmen in the United States are getting inundated with stories from the opposite side. I'll just say it like that. Call and tell your story. If you have a story much like Brittany has here in her family, because what I'm hearing is your husband had a health care plan through his employer, but the family plan, which we know all too, we know how it works, so it covered him, but if he adds the family, it was so much. And he said to you, let's say if we have this right, he said to you, hey, you know what? If you would go outside the home and just bring in enough to cover the family plan on my health care package, correct?
That's correct.
And then the provider said, we just can't do it anymore. And that's when you went down and to Obamacare, healthcare.gov. Brittany, let me ask you one more thing. How long did that meeting last? How long were you guys in there?
And everybody's asked that, and I really didn't pay attention. I know that we were in there for at least an hour. The staff had told us that we wouldn't be able to go into the Oval Office, but when we finished, President Trump basically said, these people have given up their time to meet with me. We're going to take them into the Oval Office and do a picture. So that stretched at our time there.
So you got to go in the Oval Office?
Yes, I did. And
all right, well, send me a picture. Send me a picture.
I'll do that.
We want a picture, because I watched the day, the media missed the day that he did the, sign the executive order on, with the coal miners, and he took the coal miners in the Oval Office. So you got to go in the Oval Office after an hour of the president's time. Who else was there? I think I seen in the big overall picture was Vice President Pence in the room? He was
in the room. And Secretary of Health and Human Services Tom Price was in the room. And then we had the, and I don't know his official title, but I think the Secretary had something to do with economic development, was at the other end of the table.
Yes, okay.
Across from Secretary Price.
So he brought, and I know who you're talking about, I think his name's, is it Mulvaney? But anyhow,
I don't say for sure, but yes.
I understand. I think he's who you're talking about. So he's in the room. The guy that does the budget analysis on the healthcare package. The Vice President of the United States is in the room. Health and Human Services in the room, and the President of the United States, and they bring you guys in here and they sit for an hour and they listen to what I call America say, this is what's happened to me and this is what we need fixed. Am I correct?
That's correct. And even Secretary Price even gave me an opportunity to tell, in Stevens County, we have a rural hospital that's hanging on in Northeast Georgia. There are not many of those left. Habersham sold out, Franklin County, Rabun County, all around us have sold out, but our hospital, thanks to the county commissioners, is hanging on here in Stevens County. And I talked to Secretary Price about that and how important that was for the economy of Stevens County to hang on to that hospital. And he took time to talk through some of that with me as well, and kind of, give me some information I could come back and tell some of our local leaders here about, even if they make some changes, it's still going to be a while, but I think he's hoping that we can hang on as well as we are too. So,
well, Brittany,
that was nice to get to share that too.
Well, Brittany, I will tell you this. I don't want to, I'm not interested in asking you on policy or anything like that. I'm not going that direction. But what I would like to say is, and kind of it's being a little redundant, but right now we have news coming out of Congress, we have news coming out of the Senate, we have different things being explained to us on health care, but you walk away sitting that close to the President of the United States feeling that our President really wants to put this all together and do what's best, affordable, and works for everybody. Is that the takeaway for you?
It is a takeaway for me. And he even said, and I think everybody knows that Obamacare is going under on its own. It's not substantial. It's not going to make it on its own. He even said the easy thing for them to do would be just to let that happen if they didn't care about the American people. But they want they want to change it before it comes to that, and we're in a bigger mess than we're already in. So,
Well, you
I
know what?
respect them for that.
You know what? Maybe if you could set that close and tell in the from the 9th district, you're from Toccoa, right? Toccoa, Georgia, and that's Stevens
correct.
County, right? And you're in the 9th district.
right.
So if you're that close to the President of the United States and you're getting to tell him your story on, healthcare with you and your family, and you agree that that person you met is not the person the media portrayed. Maybe that congressional officer, maybe you, now that you're friends with the President of the United States, maybe you can get me an interview. So I want to work on that, okay? I want to work on that. I mean, there's no reason the President couldn't give me just a minute to interview him. Brittany, I thank you so much. Are you home or headed home, or are you still in D.C.?
I got home last night about 10:30, and I'm actually at work today at the Stevens County Development Authority office in downtown Toccoa.
All right, well, we don't want to get you in trouble there at work. Well, okay, is everybody sending you messages? Are people stopping by and calling? So you're the big star of Stevens County now. Yes, you are. You know you are.
I don't feel like that.
Well, what's your friends saying? Are you getting all kinds of messages? Your family and friends all excited?
Yes, they like you don't understand why, now that I've been with the president, why I can't get them in to meet him too.
There you go. It's not just me. Brittany, thank you so much, and let's stay in touch. And now that I know where you're at over there, I'll send you a couple messages, and I would like to follow this up later at different times. Thank you again. You have a nice day for telling our viewers, because we do have several viewers across the nation, that President of the United States is listening to the American people. You have a nice day, Brittany.
Thank you, Thatcher. You too. Bye-bye.
Hey, I'm at a loss of words on that. That was Brittany Ivey. I'm at a loss of words on that because there's so many powerful things that Brittany Ivey just said, okay? There's so many powerful things that she just said, but what the media led her to believe on who she was meeting was completely wrong. Right there. I'm your host, BKP. We're going to take a brief break. I'm going to come back and wrap up the show. Never know what we're going to do here. Anything goes. Let's take a break.
At Days Chevrolet in Jasper, we make everything better. It all starts with a huge new Chevy selection. Then we heap on the discounts to make sure your Chevy price is the lowest you'll